Good evening and welcome to On Call with the Prairie Doc. It's not uncommon to hear stressed out city folk talk about wanting to move to the peace and quiet of the country, away from the urban hustle and bustle. But there is a price that we pay to live in a more rural community. The added dangers of the farm and ranch environment with large animals and equipment, the time required for emergency help to reach someone, and just the distance to regular health care make rural life a bit more precarious than the city slickers' lament would have us believe. First, let's take a look at this week's Prairie Doc quiz question. People living in rural regions of the country have A, more, or B, less chronic illnesses than people from urban areas. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get in your answer. We answer your medical questions, though, throughout the evening about rural health as they're called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight from Canastota is Dr. Susan Anderson, Chair of the Department of Family Medicine at Sanford USD School of Medicine. As Chair of Family Medicine, are you still the Director of the Farm Program, and what is the Frontier and Rural Medicine program all about?
Yes, I am still the director of that program, and that program is an innovative program that we started a few years ago. It was actually part of Governor Dugard's South Dakota WINS program, and there was legislation at the state level to increase the class size of the medical school. We know that we're facing potential healthcare shortages as our population ages and as physicians age. And so as part of that initiative, the class size was expanded, the Frontier and Rural Medicine program was created, and in that program, we educate a portion of the class in rural communities across the state of South Dakota.
So how big is the whole class size?
The class size was expanded to 71 students per class.
So, and how many kids are in the farm, the Frontier and Rural Medicine program?
Well, actually, initially we were hoping, since it was a new program and really the students were having to rely on our word that it was going to be a positive experience, yeah. We were hoping maybe we could get 4 the first year. And actually, we got more applicants and interest into the program than we anticipated. And now the program has actually expanded, and there's going to be 9 students next year in the farm program.
So what are the cities that this program is occurring?
The initial cities were Millbank, Platte, Parkston, Mobridge, and Winter. But since the start of the program, we've added Vermilion, and then right after the first of this next year, Pierre and Spearfish are going to have students in the farm program as well.
So that's really neat. So you're the Dean of the School of Medicine, Mary, so tell us about a little bit about what your reaction to the farm program is.
It has been a wonderful program. I am the daughter of a family practitioner from a small town, so I have always appreciated what small town physicians do and the advantages of small town medicine. But, you know, people who don't come from small towns don't always appreciate what the family doctor in the town or what the doctors in a small area do, or how important having local health care is. So this type of a program that really puts the medical students in those rural communities is important. And I should mention that 45% of our medical student class, of those 71 students per year, grew up in a town of less than 10,000. So we're drawing them from the rural areas. Many of them want to go back to the rural areas, but if you're not familiar with it, if you don't train there, you may feel a little uncomfortable. So this has been just wonderful for us.
So they get a 9-month period of time with it?
Mm-hmm. Right, correct.
Yes.
And they're all alone. I mean, there's no other med students. There are no other residents in these little towns. I mean, they're the student of attention. I mean,
there is. Winter has 2 students at times. The first time that we had 2 students go up, they didn't really know each other very well. Man and a woman student, and they got along really well, wouldn't you say,
yes.
Susan?
Why?
Yeah. They actually ended up getting married,
Oh, yeah.
and now they both
Not necessarily a benefit of the farm program.
yeah, they both matched in family medicine, so really met our goal.
So there you go. I mean, they had a good experience apparently.
Yes.
That's really great. So I think of Tony and Mary, physician friends of mine in Winter, and I look at I know that Allison is one of the internists in Pierre that was just ecstatic that Pierre is going to be bringing it, but the people who are leading are family physicians as a rule, right?
Primary care, most are family physicians. We have a community that an internal medicine physician is the physician coordinator. But I think, really the purpose of the program is to engage the student in the community, and so they can realize the challenges, but also the rewards of working and living in a smaller rural community.
Right. Not only do they see patients in the clinic, but they see patients in the hospital and in the emergency room, and they give a talk at Kiwanis,
store. Yeah.
and they see the
Right.
patients at the grocery
Yeah.
store, and
Yeah.
so those are the things that happen to people living in a small town.
Exactly.
I grew up in De Smet, I was a
nice.
bulldog, and my hero was Dr. Bell, who practiced all by himself for so many years after Dr. Hansen left, and then finally had some help with Louis, who came in. But for goodness sake, that man 24/7 for so many years, and still sang in the choir at the church, and he fished like crazy and hunted geese and ducks, but it was available 24/7 for the most part, as well as you can be.
I mean, being in a rural community, it adds a richness to life, I think, or a dimension that you can still get in the city, but it just seems to come more naturally in the country.
So what are and let's talk about the reservations and the Native Americans in our state, because that's rural.
Right.
We don't have any farm students out there. I would love for our state to be able to, for this program, and I know that we've tried to do what we can. What could be done, or what are our plans with the reservations? Or can I throw that at
you
you?
want to speak about some of our recent medical student experiences?
Sure. We've done a few things, actually. We were approached by one of the administrators in Kyle, at the Kyle Clinic, and she really had an interest in hosting students. So we've been sending actually first-year students and second-year students to Kyle for optional experiences where they stay for 48 hours, they rotate through the clinic, and some of the students' reflections on this are that it's almost life-changing for them. They feel passionate about perhaps someday working in a similar clinic or similar location because they hadn't experienced before. And I think it's similar with the farm program. You don't know if you're passionate about it or if it's something that interests you if you're not exposed to it. So we're trying to expand that exposure. We also have been visiting communities in the reservation or on the reservation that have expressed interest in having an elective where a student would be there for a longer period of time, perhaps 2 weeks or 4 weeks, and we're really making some headway on some possibilities there.
And so it's important to realize that the students have to be supervised. They can't provide direct care without supervision, so we have to have some type of a stable physician presence as well. The medical school also makes an effort to admit students who are Native American. And we have a cooperative program with North Dakota that has a federal grant. An Indians into Medicine program is what it's called. We also try to be very welcoming to any students who are Native American. We are at the 98th percentile, just about the top in the country, for the proportion of our graduating class that is Native American. It is an incredibly low bar, unfortunately. On average, we graduate 012 students per year, and that's enough to put you at the top of the country. There needs to be more opportunity at all levels for Native Americans to enter health professions fields.
And anything that we can do to try to enhance that. Of course, you
Yes.
need to have
glad
quality
you asked.
people, and there are quality
Yeah,
people on
right.
the reservation. We just need to get them here.
Oh, yes. I mean, when you were saying, what can we do, though? We have these pipeline programs, right? So we don't just run a medical school. You work with the colleges and universities. We just met with pre-medical students that you were nice enough to introduce us to.
Yeah, the
Weren't they
SDSU
fun?
pre-med students.
Yes,
Yeah, they're
weren't
great.
They were great. And but also we do work with the high school students and work before that. And we have what we call the Health Occupation Student Association, which is run through the AHEC grant, which is Dr. Anderson is the principal investigator on. You want to?
You want to talk about that?
Sure, yeah. HOSA was new to our state just a few years ago.
HOSA.
Yes, Health Occupation Student Association, which is for 9th through 12th graders that are interested in doing something in healthcare. And Brock Rops is the state director of that, and it has just spread like wildfire. And we have several schools that either have a large Native American student population or are even on a reservation that have been involved and are interested in it as well. So I think those pipeline activities will really help us increase the number of students that are interested in healthcare and perhaps that we can get into the medical school.
And I do also know that just recently it announced Avera ICU, emergency room, all that connection. Do you know the details about any of that?
I know that there, because of the changes in regulation, there's increasing opportunity for e-care to enter into the reservation areas, and that Avera has been pushing that forward. But I don't know all the details of it, I'm sorry
But
to say.
hallelujah, because it
Yes.
looks like quality improvement for the reservation, for rural,
Yes,
for all of
for
rural
rural.
South Dakota, which is so
Oh, yeah.
very important.
Very important.
Sometimes when we're around dangerous situations daily, we forget and become complacent about just how large the potential for tragedy might be.
It was a really hot July day, and I went into a manure pit to unplug a bulky pump. And I got into the pit, and I was starting to unplug the pump when suddenly I began to feel really weird. And I thought to myself, well, it must be that gas that I've heard of. And so I began to exit the pit, and I was nearly out of it when everything just faded to black like at the end of an old movie. And I'd been overcome by hydrogen sulfide gas, which is one of the most deadliest gases known to man. And my parents discovered me floating in the manure a little bit later, and they summoned help, and then I was taken to a local hospital where they basically said, he's probably going to die. But thank goodness my wife kept her wits about her, and she insisted that I be taken to Sioux Valley Hospital in Sioux Falls, and they worked on me down there and said that, well, if he lives through the next 7 days after that, we'll give him a 50-50 chance. And I was in the hospital for about a week, and my wife hardly left my side the whole time. And she came in to see me. I was in intensive care, and I was mouthing to her, I can't breathe, I can't breathe. And so she summoned the doctors, and they looked at me and they said, well, here's what we think is happening. How when your knee gets banged, it'll swell. Well, Jerry's lungs have been injured and they're swelling, and there's likely nothing we can do. You better call the family. This is it. So my wife asked that they call Mayo Clinic to see if there was something else that could be done there. And so the doctors called Mayo Clinic, and they said, well, he wouldn't last the flight to Mayo Clinic, so why don't you try to go down with an endoscope? And then they discovered that there were blood clots that were plugging some of my bronchial tubes, and they pulled them out, and then I was able to breathe much better. The short story is there was a slow but steady progression, and after 5 weeks or so I was able to walk out of the hospital unassisted. And I went back about 6 weeks after the accident, after I got out of the hospital, and underwent a bunch of extensive and expensive tests to check my pulmonary capacity, and it was within the range of normal already at that time. So I was lucky to get out of that with very little other than a few scars, and but I was so anoxic at one point that my brain had begun to die, and I kind of lost my peripheral vision. Some of the cells in my vision center began to die, so I was that close to death. The isolation is a factor, and then the fact that farmers and ranchers are their own boss, with the exception, of course, of their wives. So nobody is telling you, well, you should get that cough looked at, or, that's kind of an ugly cut you got there, you should maybe get that looked at. And, we tend to just muscle through it if we can, and probably wait too long to get treatment for something. We live and work in a very dangerous environment. There are things waiting to kill us all over the place. You know, cattle are dangerous, and machinery obviously is dangerous, and then invisible things like gas. Think and then think again, and be safe. Have somebody else around, and thank goodness we have cell phones and stuff now. We didn't have cell phones back then, so we had to summon help the old-fashioned way. But don't put yourself in a situation where you may regret what happened. You know, we all know people that are missing limbs or have died because of their haste.
Thank you, Jerry. That was a great message. That's, of course, Jerry Nelson, who is the author of Deer County Agent Guy, that book. He's an author. You know, that book is going to be highlighted in the book festival that's happening right now in Brookings. So good job, Jerry. And here's to the book festival in Brookings. And this yearly book festival is a wonderful thing. So he talked about accidents on the farm. Susan, you had some personal experience?
Yeah, I think it's probably rare to talk to a farmer that hasn't had a significant or farm accident or near miss. I was mentioning to you when I was 9 years old, my father was cleaning off a combine with an air compressor, and there was a spark and an explosion and a fire, and he spent over a week in the hospital. We were milking cows at the time, so the neighbors came over and milked the cows. But I think that's what happens in rural America and South Dakota. Your neighbors gather around you and take care of what needs to be taken care of, whether it's planting or harvest or milking the cows.
You just see that happen time and time again, where the neighbors come to the rescue.
Yeah.
Mm-hmm.
What a beautiful story that is. That's a South Dakota, well, a rural. That's a rural America story.
Right.
We have some questions we should jump into, actually.
All right.
Do rural hospitals have higher fatality rates than urban? Do you know the answer to that?
Well, it depends what you come in with. If you come in with something they're equipped to handle, they do pretty well, surprisingly. If you want cardiac bypass surgery, you may want to go to a center because they just don't do it. We are blessed, you pointed out earlier, in South Dakota that we have e-care. So there have been, our farm students have even told us, and when we were touring communities, we would have rural physicians say, you know, a car accident or a farm accident comes in and I can handle a person like that. But then if there are 2 people or 3 people and it's just me, what do I do? Well, now they push the button, and an intensivist in Sioux Falls or a trauma surgeon in Sioux Falls can help them through it. So, so the answer is, for most stuff, no, actually. The care done in the rural hospitals are doing quite well, thank you very much.
Well, in my experience with e-care is that as quality and was improving and advancing in the 90s, I wanted to take care of people in our rural hospital of Brookings, because it's a rural hospital still. In the ICU, when I have a very sick patient, the nurse would say, no, I'm not comfortable. I am not comfortable. I need to be comfortable, and we don't have enough staffing, and so on and so forth. When we got EICU, suddenly we're able to keep the sick patient there. I have an opportunity to sleep the night and not worry about my patient that's in the EICU. It enhanced the quality of care in our hospital. And that's the same thing that happens throughout South Dakota when you're using a lot of electronic medicine. There's another question about medication for osteoporosis. Is there any reason for continuing to take medicine if I can play golf and everything's fine? That's a great question. Susan.
Well, absolutely. The fact that you're functioning well and feeling good doesn't mean that the medication isn't necessary, regardless if that is medication for osteoporosis or for your high blood pressure or for your high cholesterol. We want you to feel good, but definitely staying on the medication and going with the recommendations of your physician is the appropriate way to go.
And I think that what Susan just said is important with the recommendations of your physician, because there are some provisions now. I just read this article an hour ago, and I don't know why. New England Journal had a review on osteoporosis. There are some provisions where people are experimenting with what they call drug holidays, where they will take, if you've been on it 5 years, maybe you can go off of it for a period of time with careful monitoring. But what Susan said is quite correct. That's an individual patient physician decision. The standard line is, if you don't know, stay on the medicines.
Talk to your doctor about it. But I would also say, and the contra coup of this whole argument is that there is nothing, no pill can compare to a regular exercise program in making those bones strong. So, I mean, golf can be very much riding on a cart and walking over and then hitting the ball and
We'll
then
take
getting
your
on the
word
cart. But, I mean, staying active is very important. But, you know, physical activity, you know, where you're going to end up, and we're doing a study right now about hopping, that puts stress on those bones, which makes them stronger, better than any pill. So that's a good, there, we had disagreement, but not just terrible disagreement.
No.
Talk to your doctor.
Right,
Make sure that you talk
right.
to your doctor. What steps are being taken to improve health care availability in rural areas? And the School of Medicine is part of it.
Right, and I think one thing that we learned when we did site visits to determine which communities would be good communities to host students was the technology that is available, the facilities that are available. And I think these communities and the different systems are really doing the best that they can to make sure that there's quality health care and that there's facilities that physicians are going to want to come to practice.
Well, and there's also nurse practitioners and PAs. Let's talk about that. Mary, any comments?
Well, no, I think that that's a very important part of the health team. I think the key thing is team. It doesn't matter if I go out there as a physician to a small town, if I don't have a nurse or if I don't have enough backup, I mean, I'm really not that much use to you. It really is a team, medicine is a team sport now. So recognizing that the state itself has developed a health provider reimbursement program. So for non-physicians, for example, like PAs, NPs, even nurses, they who practice in a small town, the state will pay, I think it's around, it's in the neighborhood of a $10,000 premium to practice in that area. And for physicians who practice 3 years in a rural South Dakota area that's participating, they will pay the equivalent of double the tuition for 4 years to the medical school, which somewhere around $180,000 that they would give that physician if they stay 3 years in the rural area. And if we find if they stay 3 years, they usually stay.
Yeah, people do stay. So my comment also would be to address this. I'm going to make a statement about PAs and nurse practitioners and physicians all alone in a rural area. When you're all alone, it's tough. That's part of it. If you talk about a lone physician in a community, what often happens is that she or he can get a nurse practitioner or a PA to help, and then they've got sharing that can occur. Most important thing, though, I remember little towns when I was in my early years here would be all alone and not collaborating. They'd be all alone, practicing alone, not collaborating. Physicians alone, not collaborating. That's an opportunity for disaster. Same goes with nurse practitioners and PAs all alone. We need to collaborate. Whatever your training may be, we need to be connected, we need to collaborate, we need to always be talking with each other. Any comments or responses to that point?
I couldn't agree more. And the sites that were ultimately selected for the farm program, there was evidence of that collaboration, either with regular visits by specialists from a whole array of specialists that come to the community to see patients and collaborate with those local physicians. And all of the communities also have advanced care providers, physician assistants and nurse practitioners that are part of the team as well.
All right. Well, I want to make a point. This is your show. Your questions are key to our show. We appreciate the calls that we've had. We need more calls. Call in your questions about rural health at 1-888-376-6225 or send us an email to the email on your television set. There is a question about higher rate of abuse of alcohol or use of tobacco among rural youth. Any comments or opinions on that?
There is some data on that. Nationally, that is true. There is in rural areas more use, especially among adolescents, of both tobacco and smokeless, like e-cigarettes and things like that in rural areas, and also alcohol. Interestingly, the Helmsley Foundation did a survey of rural areas, and in South Dakota, the alcohol issue does not appear to be very pronounced in our rural areas. I mean, it's about the same as it is in the cities.
In South Dakota, but not necessarily the other
not
parts.
nationally. Nationally, rural areas have a somewhat higher incidence of alcohol misuse and a somewhat higher incidence of smoking in rural areas. So there's some fact in that.
Wow. Are there certain diseases or illnesses that are more common in rural areas than urban areas? Susan?
Yes, we do see more heart disease, more chronic illness in rural areas than in urban areas.
Why would chronic illnesses be?
Well, there's a few theories. One is that the population is older, so in an older population you're going to see more chronic disease. Also, lack of access to appropriate health care is a factor.
I mean, unfortunately, that's part of what happens. That you have to travel 50 miles, and you get there, and they're full because that's the only person in town, or that's the only clinic, and so the access is harder, isn't it?
Yes.
And that's the dilemma that we're struggling to work on. So we'll go to the next question. I think about the fact that the highest percentage of the elderly, what is it? It's the number of who can get the oldest. Where are the oldest people in the country? That's it. Where are the oldest people in the country? And it's Brookings, Olmsted County. I mean, this right here in the state of South Dakota and on the edge into Minnesota, we have, it isn't Olmsted, it's this, but it's right here.
Mm-hmm. Right.
This
exactly.
is where, and maybe it's because all we have is old people, but that's not it. I think what we have are old people that live a very long time. Mm-hmm. Maybe it's the German-Norwegian genetics. Who knows? Do either one of you have an opinion on that? Took me a while to get that one out of it.
It's well known that, at least in South Dakota, it's a good place to be old because you're likely to get older. Yes, and it may be because people have worked hard and they've taken some good care of themselves and they're self-reliant, and all of that goes into it. I don't know that there's a magic formula that I know of that goes into it.
I think it's activity. It's exercise. It's physical activity that I think is the key. Susan, you?
Well, interesting little tidbit about that. We're starting to do some screening activities with students from different disciplines, and we're going to rural venues to screen the rural ag-related population that maybe doesn't come in unless they are really deathly ill, or they certainly won't come in during planting, harvest, calving, that sort of thing. And so, for example, we went to the Dakota Farm Show in the Dakota Dome in January, and one of the things that we were doing was grip strength testing. And we found that a lot of these individuals have amazing grip strength, and they're elderly men, because farmers don't retire either. They keep working. And when we'd ask them, wow, you've got great grip strength, they would say things, well, it's from milking cows X number of years ago when they used to do it by hand. Now, their blood pressure wasn't quite as good, but their grip strength was really, really good.
But that's what they do. They don't seek help until they're really, really sick. I was at a meeting 1,200 miles from here, and a guy from the Mayo was saying, and we have a syndrome at the Mayo Clinic called the South Dakota syndrome. A guy walks into my office and his creatinine is 10. And he said, I wasn't feeling quite right, and I thought I'd go in and see my doctor. Creatinine meaning that his kidneys had failed, and they'd been failing for a long time. So there it is, South Dakota syndrome. Prevention is better than a cure, even when it comes to farm safety, and especially when children are around.
Farm safety when you're trying to raise a family on a farm is important every day, all day. as a mom, I'm worried about everybody that's outside on the farm.
We teach our young kids to respect the large machinery, you know, not go near it by yourself if it's running, wait for an adult. Stay in if they're riding with us, stay in the cab, don't touch anything. We shut the tractor off when we get out, so they're, you know, and kids are curious, so they're going to get off the seat and they're going to push buttons and whatever. So anytime they're with us and we get out and they have to stay in, then we just shut the tractor off.
And if you ask our son, he'll tell you, I can't ride in that tractor because it's not safe. He knows what's safe and what's not. We also try to make sure there's designated areas on the farm for the kids. They know that grass is a safe place to be. They know that if they go off the grass, there should be no running equipment. They know that when they go off the grass, they probably should have an adult with them, or they know that when they go off the grass, somebody should be watching them, because that's where farm equipment is. That's where cars are coming and going, and that's where it's just not as safe. We do have a designated play area on our farm that is fenced in, and the children know that if they're in there and the gates are closed, that that's a safe area. Safe from equipment, safe from animals, safe from everything. And as a parent, I know that if the children need to be somewhere while we do something shortly, and we can still see them, and you know, they're in our bird's eye view, that they can be in that area and it's safe for them. And it's fun. It's a play area to keep them busy while they're safe. They're swinging, they're playing in the sand, they're having a nice time.
Kids can move around. I always look around when I'm running around on the yard with a piece of equipment just to see where the kids are. Katie and I are always in communication. Hey, I let the kids come outside, so you need to watch out for them. Or if I'm coming home from the field, you know, I don't know if they're outside or not, so I slow down when I pull in the yard. We usually keep a gate between us and the cattle when the kids are with us. That way, there's no way that we can get hurt.
Typically we have another adult watching them for us, but there's that moment there, you don't have another adult, so we make sure that they're in a pretty safe spot.
Even for an adult, you know, like during harvest time when you're pushing and you're trying to get done and something happens and you're like, well, I'll just leave everything engaged and go fix this problem. And all it takes is a split second.
Or I'm tired and I'll just go for another couple hours because I can finish it. It's not worth it.
Yeah.
It's not worth it. There are days we probably could get stuff done a whole lot quicker, but when you try to be safe, we know it's the better option.
Right.
Some of you might have noticed that that farm wife was the dietitian that occasionally presents on our program about particular diet issues and so on and so forth, Katy VanderWal, and we appreciate her so very much. Well, what a nice farm, and thank you for doing that. Farm safety is a very important issue, and we did talk about it earlier. Any comments that you would have, Mary, about that issue?
I agree with Dr. Anderson and with you that prevention is the key. And with this family, they didn't wait for something to happen. What they're doing is trying to prevent and try to make things safe. And it is a problem, you know that it's going to pour rain and you want to get the crop in, and and something gets caught. It is very challenging, and I get that. But the emergency rooms, are full of people who did things a little too quickly and didn't get away with it that one time.
At least the corn picker accidents aren't happening anymore, but they used to try to pull that thing out of the corn picker and lose a hand. Susan, any comment about that? You gave your example of your dad getting, where a freak accident, but you have those kinds of equipment.
Right. And there's a lot of safety measures that have been put into place to try and protect farmers. And even if you do everything right, accidents may happen. And you lose a finger, you lose a part of a finger. I remember growing up, my dad never wore his wedding ring, and I inquired about that, and it was because it was too dangerous. You get your wedding ring caught on something and your finger's gone. So it is definitely a dangerous occupation.
Well, the power takeoff, don't take the cover off.
Yeah.
Leave it on, let it protect you.
Yeah.
Does our state have less access to medical assistance than in an urban area, or are services more expensive because they're less available? Now, that was a question that somebody called, and that's an interesting question. Does our state have less access to medical assistance than in an urban area, or are services more expensive because they're less available?
So because we're a rural state, there are some differences in Medicare rates according to whether you're in an urban area or whatever. So your doctor may get paid less in certain circumstances than in others. There are ways that the federal government's tried to mitigate that by declaring some hospitals to be critical access hospitals or rural hospitals. We have a high number of those in South Dakota. And recent legislation has reduced some of the reimbursement to those hospitals. And so that type of activity is particularly harmful to a rural state like ours.
Right.
And also, Medicaid expansion. States with rural populations that don't expand Medicaid have a higher burden, financial burden, because they didn't get the benefit, but they have the downside of getting cut on the critical access hospitals.
And primary care doctors are not as well paid as the specialty people, and primary care docs are out there in the rural areas. Any comment about that, Susan?
Well, as Dean Nettleman mentioned, there is some incentive. The state has some incentive to try and make it more appealing with that program. There's other loan forgiveness type programs, and some communities actually will have their own loan forgiveness, to draw.
Entice them into that little town.
Right. And there are some things in a rural community that are less expensive than in a larger community. Often housing is not as expensive, and other things are not as expensive. So it's a trade-off.
It's a trade-off.
Yeah, the answer to the question is yes and no.
Yeah, you can live cheaper in a rural area in many ways, but at the same time, your income may not be as much. But then again, I'm not complaining about a physician's income.
No.
But we're talking about drawing people to rural areas. That's the question.
Right.
A woman asks, I have a problem with dry eyes. I use eye medication for dry eyes, and I also use other drops. I thought that I heard that distilled water can be just as effective. Is this true? I don't think so.
Yeah, it depends on what drops you're using, but no, generally. And you certainly don't want to, distilled alone, you don't want to put things that are not sterile into your eyes.
Right, distilled
bad
alone.
Bad things can happen to you from that standpoint.
Well, and water is hyponatremic. It's no. The answer is don't put distilled water in your eyes. The answer is no. You can buy over-the-counter, relatively inexpensive methylcellulose drops or easy, lubricating drops and lubricating ointment that you can put in at night. It's a little gooey, but it's at night. Who cares? And then that's the better option.
Of course, the real question is, why do you have dry eyes? Is it a medicine we're giving you? Do you have allergies? Is there anything we can do to help reduce the need for that? So,
probably the biggest culprit really is medicine, but sometimes it's nobody's fault. You're just dry eyes. You're older, and or you could have a particular immunological problem that dries your eyes out. Any other comments? Dry eyes. Allergies, those can be the big bugaboo as well. Can our guests speak about the age that South Dakota allows people to start driving, and is this a safe practice? Good question. Susan, when did you start driving? On the farm, my guess is 10. On a tractor.
Well, it depends on what you're talking about driving, but on the roads, no, I was more like 15. And I think part of it is, necessity. Getting to school, getting to where they need to be in rural areas.
Yeah.
I also think that there are, young folks that grow up on the family farm, and they do start working with equipment at a young age.
Yes.
I read a statistic, there's about 2 million farms in the United States, and about 850 children live on those farms, and about half of those children do some type of work on the farm. I know that my brother started at a very young age, running equipment and being active on the farm, and my 2 nephews that live on that same farm are doing likewise. So I think if we have a good driver's ed program and
and there's a work permit. They allow them to drive during the day at 14 or something.
Right. And
so the farm kids can get in.
Mm-hmm.
Yeah, and I remember learning how to drive on the Wallam's Ford tractor. And of course, I didn't tell my parents. And I remember Arden and Arlen Wallem were driving the combine at 12 or 13. I mean, that's just the way we did it.
Yeah.
Are there adequate nursing home beds for our aging population? How are the number of beds set? That's a great question. That's a rural health question. Mm-hmm. Susan, you know the answer? That's a legislative answer, isn't it?
Well, I think there are nursing homes that are full and there's nursing homes that aren't. I think some of it also has to do with where is the potential nursing home resident and where do they want to go and where does their family want them to go. We have a nursing home in the small community I live in, and for quite some time there were several empty beds, but then they did a creative program with the Human Services Center, and now they have several behavioral beds that are specific for patients with certain diagnoses, and so now they're more full. So I think it depends on the location.
Yeah. Well, I know that the nursing home, for example, the nursing home, I'm the medical director of the nursing home in Arlington, and it's a community business. I mean, there are people that are employed there. It's an important employment center.
Absolutely.
But what a wonderful nursing home. I mean, and the care that they get and the love that they get from the farm wives and the people that are, the rural community come together and support each other. And I mean, we have wonderful nursing homes in Brookings, but I'm proud of the ones that are in the Esterline nursing home, fabulous nursing home, and Arlington as well. So they're important things, but there's only so many beds you're allowed in South Dakota, and you can't exceed those numbers. And I know that White just closed its nursing home, and there's some beds available, but it hasn't been grabbed yet or something. I mean, they only allow a certain number of beds. 60-year-old person from Britain, could you go back and talk more about the farm program specifically? Do you think they can expand the program, and what would it take to improve the program? And we don't have a farm program in Britain, probably, do we? No.
We don't. Well, how the communities were chosen was based on them applying to be a farm site, but we wanted the students to be able to get all of the clinical experience that they would get at any other location. So that means each site had to have a surgical presence, not necessarily a surgeon there every day, but a surgeon there on a regular basis so they could get in some surgical cases. They had to provide obstetrical care, meaning they had to deliver babies, and there had to be enough volume of patients that the student could get an adequate experience that would be comparable to a student that was in Sioux Falls or Rapid City or Yankton.
Right.
And so not every small community hospital has all those services. And as far as expansion, again, we were given a certain number that we wanted to have in the farm program, and we expanded a little bit when we found that there were other interested communities, but expanding further would have to be based on how things go with the communities that we have and the students that we have.
Yeah. You don't want to overexpand and get to a point where you're not doing a really good job. You got to do, this in particular has to go perfectly.
Right.
I would sense.
Yeah, and we just graduated our first class that went through farm. So
and they do that the junior year?
They do it the equivalent of the junior year. So when the students were seniors, they just graduated.
Now I know that at the end of the sophomore year in the old school, we would go out all through the state for a month. And I mean, I hung with Joseph Mugley in Madison, who was a surgeon there. He was a retiring surgeon while he was in his late 70s. And it was the greatest experience. I'll never forget. I was just talking about that experience today, about delivering the first baby I delivered. I mean, it was quite an experience. Are they still doing that?
Yes, a lot of the patient care is integrated also into the very first year, and so it's different. We used to have mostly classes, and then we'd have an experience that would start a clinical experience.
Yeah.
Now we integrate that from the very first week. The students are with physicians, seeing patients. You've got to think that these are very highly motivated South Dakotan students, and they want to become doctors, and they've just gone to college, and what we used to do is just put them back in a classroom and make them college students again, which kind of kills your joy. And so we learned that we have to get them out into the field, and then their classes make so much more sense.
Yeah, and it makes and we're the leader in the country with this kind of program. I mean, Yankton
Yes.
is the example that Harvard has been copying.
Right.
Yes,
They say
exactly.
it's the Harvard program.
Yeah, we call Harvard the Yankton of the East. Yeah.
Harvard is the Yankton of the East. 61-year-old man from Rapid City. Man's wife was diagnosed with multiple myeloma, and so was her cousin. They were both raised in the same farm. They would hold flags for crop sprayers and get doused with chemicals, and then would clean out the 2,4-D chemical specifically for weed control out of the sprayers. There's been a recent study by Creighton showing a correlation to cancers and the exposure to these chemicals. Do the doctors know anything about this correlation? If so, please explain it.
I don't know that I have any specific information on that, but that is one of the hazards of the farm life, is exposure to chemicals, and it is something that is being increasingly recognized. They have a broad effect on your own genome and on your cells, and so they may, the side effects may appear years later, and again, safety first on those areas where there was no option for it when they were growing up. For the collar, there was no option, but now there is.
And we didn't know.
Right.
So here you are, and the sprayer comes flying over. I mean, I've flagged for sprayers before again, on the Walham farm. I get exposed to these guys.
Yeah.
But I know of a man who was dying of leukemia, and it might have been multiple myeloma, actually. And he was a crop sprayer, and he said, well, I used to put my hand down there and stir it really good with my hand, and maybe I shouldn't have done all that exposure that I had. And I truly believe, and this is a question, I think the answer is there is a correlation, and I don't know how they have defined it, but I think that it's
I don't
there.
know the data. Right.
Via email, is there any way to deal with the exorbitant cost that a helicopter ambulance service to a larger hospital sometimes occurs for those out in rural areas that need some specialized emergency care, as this service is not generally in insurance network? The patient has to deal with the cost, which is often greater than the medical cost. So any comment about that helicopter?
Well, this is actually one of the issues. The transportation cost is one of the issues, one of the things that Governor Dugard ran into, and so does Alaska, from very remote areas that should be covered by IHS, and they're not covering the transportation costs. Somebody has to eat that cost, and then the patient goes broke trying to pay for it, and the system goes broke trying to provide it. So it is a very problematic thing.
No good answers right now.
There's no answer if you have to go there. One of the better answers would be to build up the capacity in the rural setting, or to send out some form of regular transportation for routine things.
Right.
But
Do
if you
not
need
use a helicopter unless you absolutely need
Oh,
it.
you wouldn't be able to, but if you need that helicopter, you just
You
pretty much
want it.
need it. There's not a lot that can be done.
Really quickly, 86-year-old woman from Aberdeen, shots for osteoporosis safe. I'm getting it Monday. Any comments?
Yeah, I mean, I don't know which ones, and not speaking specifically to her, but we do, instead of giving pills, occasionally we will, I'm assuming she's taking one of the pills that are specifically for osteoporosis and not just vitamin D or something, but those intravenous forms of the drug are efficacious, and you don't have to take them as often. They're more expensive. Other reasons why some people don't get them, but they are shown to be effective in people with osteoporosis in preventing fractures.
10 seconds. Susan, any final words?
Well, actually, as I mentioned, I asked my brother, who's a farmer, what the biggest risk is for farmers these days, and he said obesity.
Okay, obesity, we need to work on that. And now for the winner of tonight's Prairie Doc quiz question. People living in the rural regions of the country have A, more, or B, less chronic illnesses than the people in the urban areas. The answer is A, more. It was Edwin Call from the Pier area who answered the question correctly. Thank you, Edwin, for participating, and a book will be in the mail to you soon. We'll be right back. Well, I want you to respond to that. We have no more time. We'll be right back after this.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too, and some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule, so he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
Our eldest son, who now lives in Brooklyn, New York, came home to South Dakota for vacation recently and commented on the contrast of city life with that of rural Prairie. In South Dakota, he loves how he can see the stars and the Milky Way in the sky, the morning tangerine sun rising in the east, and the space and lack of congestion in shelter-belted houses surrounded by fields of abundant crops, separating the miles between small towns. Homegrown tomatoes here have even prompted him to name South Dakota in August as Tomato Christmas. It's so different than life in the city, he says. The tall buildings with city lights on all night long wash out the stars. Usually the sun is up for hours before it's seen. Sidewalks are full of people rushing to and fro at almost every hour. Towns have filled and merged such that there are no open spaces between them. And aside from parks, there are too few growing places in the city. He says the beauty and wonder of rural life becomes more apparent only when you've been away from it for a while. But rural, more remote living can result in significant health risks because when there is an emergency, extensive travel can be required, even to the closest hospital. Then, that small town hospital may be without the tools and experience to help you. Even with helicopters flying to the rescue, rural living may still mean delay in care when minutes can matter. And when a medical problem is not so urgent, rural people often have to travel long distances to obtain outpatient medical, subspecialty, dental, and pharmaceutical care. The result, as outlined by the National Institutes of Health, is that too often rural residents delay care. Problems become more serious and higher rates of chronic disease occur. In addition, with farmers' potential exposure to chemicals, excessive dust, and dangerous motorized farming equipment, farming is rated the second most dangerous profession, just behind mining. But electronic connectivity, like the e-intensive care unit and e-emergency room, communicating health information between small rural hospitals and more urban specialty centers, has made the risks less. Add to it your Prairie Doc television program endeavors to reduce rural risk by bringing science-based health information to the people of this rural region. Although living in a rural area carries some health disadvantages, the risks have been reduced. This makes living here even more worth it, especially during Tomato Christmas.
August is Tomato Christmas. The summer gives tomato and pleasure and song, and all the spirit.
And that was Eric singing his creative song, Tomato Christmas. A big thank you to our guests, Susan Anderson and Mary Nettleman, for volunteering to come to the studio and share their insights and experience tonight. We're rapidly approaching our flu season here in Midwest. Prevention is key to avoid that, so get your flu vaccine now. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Breathing. It is as simple as that, but not always. Every breath we take. Next time, On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
And with the ongoing support of these individuals and institutions.
Brookings Health System, Ophthalmology Limited, South Dakota State Medical Association.
Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, and Vance Thompson Vision.
Aberdeen Asthma and Allergy, Dakota Bank.
Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Regional Health, and Swiftel Communications.